Hi, good evening, and warm welcome to and thanks for joining us for Urban Thinkers Campus on role of multi-level governance for managing pandemics and building resilience of Indian cities. A very warm welcome to panelists and participants for this webinar, and greetings from National Institute of Urban Affairs, a think tank of Government of India. Uh, I will not start with the I start with a very positive note that COVID-19, even though has brought a lot of challenges, it has also created a lot of opportunities for all of us to think new, to think differently, to move away from business as usual approach. And we saw the COVID-19, different levels of government and different within the same level, different verticals of government worked very tandemly with each other and responded to the crisis. So I think another thing which has really emerged is that resilience is becoming another critical, lens, or is emerging as an urban lens for as a convening power to respond the crisis. Uh, but when we say that what should be the next, how should be the new normal, even though I don't like the word new normal because it really is, but how do we move forward and take a new business as usual approach? I think we all, when we talk about cities, we talk about equity, economy, we talk about environment, but I think the major focus based on this crisis we have learned is the governance is becoming a fourth dimension and the main dimension when we are talking about different interconnection of different levels of government, different verticals of government, and how we really want to work together and manage this complex and highly tangled issue. So these are big challenges. There's no simple solution, and nobody can say that this is the way things should go. We have to work in different models of governance, and how they should work need to have a continuous dialogue, continuous deliberation. And I think the Urban Thinkers Campus gives this opportunity for all of us to really talk together, put our brains together, and think what should be the new normal, if we call that a new normal. Today I will not speak much because we have uh, great experts and stalwarts in the sector who are there to discuss on this new normal, or different multi-level governance structures which can emerge to a new business approach which cities should take forward. As a part of National Institute of Urban Affairs, we have already started this type of dialogue series where we are thinking as an urban think tank how we should really go about it. And we are, like this type of webinars where we are talking to different types of stakeholders at different levels of different sectors. So that's the idea where we are taking forward, and through this number of webinars, online workshops, and sharing of thoughts, we want all of this to come and emerge as some kind of a new way of looking things post-COVID situation. So I just want to have today's, we will have a two parts, the whole discussion. First part will be what has been the city's response to pandemic, where we have lined up with the great experts, which will Professor Santosh Kumar from National Institute of Disaster Management, Professor Dr. Pangotis Karamanus, India Program Lead for International Urban Cooperation, Mr. Mahesh Harare, Chief Resilience Officer, Pune Global Resilient City. So it is a combination of practitioner world, it is a combination of academics, and it's a combination of policy level people together. And this session will be moderated by Raina Singh, who is a senior fellow at NIUA. And the second panel, which is again bringing of how should we leverage multi-level governance for strengthening urban resilience. And this will be moderated by Dr. Uma Maheshwaran Rajshekhar from NIUA. And we have Mr. O.P. Agarwal, CEO of World Resource Institute, Mr. Amit Proti, Managing Director, Regional Global Resilience Cities Network, and Ms. Charu Chadda, Policy Program Manager, India and South Asia, Facebook. This great panel will be talking about the challenges and opportunities and how we should really move forward towards a new normal. And I hope today's discussion will provide us further insights and recommendations towards these objectives. And let me again take an opportunity to thank all the panelists and all the participants who have joined us from different parts of the world, uh, uh, and to have this relevant discussion and to take this discourse of new normal, if we so call it. And we don't have any alternative world at this moment, but welcome. And I'll hand over to Rena to take up with the first panel and take the discussion forward. And thank you again. Thanks, Rena. Over to you.
Thank you, sir. Thank you for kickstarting the session and for all the inspiring and positive words. Good evening, everyone. Welcome again to the COVID-19 Urban Thinkers Campus series of the World Urban Campaign. My name is Vaishnavi Shankar. I'm a fellow working on urban resilience at the National Institute of Urban Affairs and will be your host this evening. This particular Urban Thinkers Campus, as sir mentioned, is organized by NIUA to bring together experiences from various cities across the globe and reflect on the collective learning for managing pandemics and building urban resilience through multi-level governance. This is the last of the Urban Thinkers Campus series, again, as sir mentioned, that is being organized in partnership with the Sushant School of Planning and Development at Ansal University, US Green Building Council, European Urban Knowledge Network, Regional Studies Association, Madras Chamber of Commerce and Industry, and the Bombay Chamber of Commerce and Industry. I would like to inform you all that we are live streaming this campus on our Facebook page, and would also encourage you all to tag us in all your social media posts. The details of the hashtags and the relevant handles are shared in the Q&A box. So again, we have two interesting panels today, and in addition to that, we will also be conducting 2 polls. These polls will be contributing to the discussion in each of the panels. Our first poll captures your opinion on the key aspects of cities that have been critical for responding and managing the impacts of pandemic. You can see the poll question with the 6 options in the menu on your right in some time. So this poll will be active through the first panel, and I encourage everyone to participate. Taking a few questions at the end of each panel, and we'll request you all to use the Q&A window for posting your questions. So it's time for our first panel on our city's response to the pandemic. I invite my colleague and moderator for this panel, Rena Singh. Rena is an urban planning and climate resilience expert with over 10 years of experience in policy research, technical advisory, capacity building, and program management. She has contributed to implementation of key national and international initiatives towards environmentally sustainable, smart, and resilient urban development in over 25 cities across South and Southeast Asia. Currently, she is anchoring policy research and advocacy and partnership and engagement efforts for strengthening resilience of Indian cities as part of 2 flagship initiatives of NIUA, which is the Urban Resilience Unit and the Climate Center for Cities. Over to you, Rena.
Thank you, Vaishnavi. Thank you for that nice introduction. And with this, we'll start panel 1. Just to let you know, I think we are still awaiting some of the information about the social media. So in the meantime that we start the panel, perhaps that can be added. So let's begin this panel. Before I call upon my fellow panelists, perhaps I can set a very brief context for this session. As you know, a lot of you who are participating in this campus today are urban practitioners. You have been working with a lot of cities for some time. Some of you are also part of the research and academia. And we have seen that cities across the globe are getting severely impacted by the pandemic. And at the same time, they are also playing a key role towards the response to the pandemic. In India, we have seen how cities like Delhi, Mumbai, then Pune, Ahmedabad, Surat, and now Bangalore, Chennai, Hyderabad have been some of the worst affected areas. Now we are also seeing a lot of increasing cases in Tier 2 town. In terms of the response, we have seen that the urban local bodies have been at the forefront. They have been monitoring on-ground health services. They've been supporting the relief and response measures, as well as maintaining supply of essential services throughout the lockdown. And this has, of course, been with immense support from various state and national governments. At the national level, we have seen how the national government has invoked the National Disaster Management Act and through the Ministry of Home Affairs has been providing all the overarching SOPs, the financial resources to manage the pandemic, so on and so forth. So in this panel, we are going to discuss how some of these existing mechanisms of governance and coordinations have worked or perhaps not worked, and what have been the key learnings for addressing such risks in future. On that note, I'm going to invite our first speaker, Professor Santosh Kumar from the National Institute of Disaster Management in India. And as was mentioned, he's currently a professor with the National Institute of Disaster Management, and he has over 25 years of experience in disaster risk reduction, policy planning, and capacity development in the DRR sector. Apart from working with the Indian government, where he has contributed to many key guidelines of NDMA, he's also been supporting a lot of initiatives of the World Bank, and he has been a crucial member, driving many instrumental initiatives of the intergovernmental body of SAARC nations. So, Professor Santosh Kumar, may I request you for your initial remarks?
Everyone, thank you, Raina, and all the distinguished panelists and the guests who have joined this important evening for the discussion on new normal, what it is was mentioning about that little difficult to accept this term, but nevertheless we have to use it. Point which I would like to mention in terms of Disaster Management Act and also in terms of the disaster management framework, and then how COVID landed up as a kind of a surprise to us. In fact, before this, when it happened in Wuhan, nobody was actually, in fact, looking at this as that likely affected in such a way that whole globe would be affected by this pandemic. Although that in 2016, the World Bank had brought a very good report on pandemic risk and quantified this economic loss leading to almost $3 trillion in the case of outbreak of pandemic. But it never gone into the governance of pandemic across the globe. Many of the countries did not. Those who had certain kind of experience of SARS and other pandemic, smaller and epidemic, you can say, that confined to the country, they have been able to perform well and their governance could respond as they had this experience. But what happened after February when this from one city to 123 countries in the world got affected by this? So one that I would quantify this as qualify this pandemic as a kind of a transboundary disaster. It just did not confine to one, so that is why it is pandemic. So taking this pandemic and how our governance is equipped and how we have been able to, we've gone through different kinds of lockdowns and kind of challenges which we had in maintaining the supply chain and making cities alert on that how the public health system is working. So that was the dual challenge in terms of that going for the lockdown, maintaining the supply chain management, and also having this great lockdown. So both doesn't go together, but we need to have this. So lockdown 1, lockdown 2, lockdown 3, if you recall, that how we spent our time during those periods, and how the municipal governance was active all through in maintaining this hygiene and sanitation and other 3-4 things which came up as a big way. One is this, that having this mask. Second is the sanitize your hands. So these two itself was a big requirement during that time. And country was not prepared, the governance was not prepared to supply to 130 million people. So 130 crores of people is a large number, and supplying, this is one disaster that happened in the country where almost everyone is affected. Most of the disaster happens where limited pocket, 1 state, 4 states, 5 states, they get affected. And within the states also, few pockets of the people, few cities are affected. But this was one where almost all the cities and almost all the individuals in the country got affected by this pandemic. So the challenge to the municipal corporation was just not mask and the PPE, but public health system to be. So that lockdown was basically to kind of, you can understand like this, that preparedness of the public health system. So that was the lockdown advantage that we had this, and after that, unlock 1, unlock 2, and unlock 3. So gradually this opening up. These are this different kind of challenges. Many of the cities, even if lockdown and unlocking the cities, we don't have that much of capacity of testing, that the municipal corporation or the public health system doesn't have that kind of a capacity. Although the disaster management in the governance pattern, when you check, the governance has been divided into two. That other disasters, this National Disaster Authority, National Institute of Disaster Management, and all these state disaster authorities, and so on and so forth down the line, there is a system and district disaster authority. But combining with the COVID, it's a mixed response. How much role that Ministry of Health and Family Welfare is playing along with the National Disaster Authority. Same with many of the state government, the state disaster authorities are not playing major role in management of the COVID, but the Department of Health and Family Welfare has taken the charge. So there is a bit of confusion in terms of the governance of COVID-19 itself. So, but gradually we learned also during the process that when the Disaster Management Act enforced this lockdown, then the role of these institutions came automatically in the purview of the management. So one is this governance and enforcing to the local government, how much local governance is capacitated to actually look into this huge pandemic issues. So that was another challenge. So people became on their own at times in whether buying vegetables or buying a day-to-day need, and so they were not dependent on the government on many more things, but they were on their own. Government regulated many things, so that government was into the regulatory mode, not into the form of supply chain management. Supply chain management, they did this, the decision-making process, but not taking things to door kind of activity, and that was not expected and not the capacity of the governance to take this also. 2 points I would like to highlight in terms of the beginning opening statement. So the biggest challenge came even today. I'm saying the COVID is not over today. It is combining with other natural disasters as well. So like we had seen Apan in the last month, and we saw that how this West Bengal faced this problem, and Orissa also got affected, then it went to Bangladesh. So that how to manage this entire disaster response with the COVID, like new normal, like that whether the disaster response responders are aware about the protocols of the COVID-19, and the rescuers, and the rescuee, whether they are aware about it, how to manage this disaster relief system. We are not going to check their temperature and other this testing and then putting them into different kind of a relief camps. So we do not know even today that when before putting this relief camp, what was the status of COVID-19, and after putting into the relief camp, what was the situation, whether it has increased or decreased, and so on and so forth. Many of the National Disaster Response Force, State Disaster Response Force, they responded to this disaster. And this disaster, what happened to them, whether they got affected by COVID-19. So if they are, earlier they used to move, say, 20 people in one trucks, whether they are moving in 10 people in one trucks with the social distancing or they are not. So entire preparedness and response gone into a sea change in the new normal. We cannot have the similar kind of a disaster response that it used to be before March. So now the system is changing, governance challenge is changing, and also at the local government, which is like Mumbai Municipal Corporation is a big corporation. Delhi Corporation is a big corporation, but many of the cities in the country are still decapacity. You can say that the capacity is not to handle such kind of a crisis. So now the new one is this: the testing, taking them to the district hospitals, and also providing those services by the district hospital to the people. So initially you might have noticed that 7%, 8% was the recovery rate. So that was the hospital and health services preparedness in the cities. So and also cities is not a homogeneous; it's a heterogeneous concept. And in this heterogeneity, 1%, 10% living in one room, so social distancing is not possible. Squatters doesn't have this kind of a social distancing possibilities. So how this COVID-19 would change the settlement pattern? So that is also going to be a kind of a new question in the new normal, that as a planner, when we are making such, earlier we used to make one community pump, and then people used to come and fetch water and then go to the home. probably this will not work now. So whether they are maintaining distancing or not. So entire protocol of COVID-19 have to be brought in the urban planning system as well. So what we are not aware whether somebody is saying that. So it's a confused, no, because that we do not know how this virus looks like. Every 14 days it changes its kind of a character. So that's what we are saying. This uncertainties is very high. In this uncertainty, we do not know how to actually capture the entire urban planning process to address this issue. And somebody is saying it will be staying with us for another 2 years of time or 3 years of time. Still unsure about this. Then we will have a second wave. We do not know. So at least even if we are planning for 2 to 3 years of time, we need to look at that how this urban planning can readjust within the system which we are talking about. And especially I will focus on one issue is the gender, because they have the right to gender. Why I'm saying that they are the most having this the impact of COVID in the urban cities. The violence is increasing. The challenges are increasing. Violence against women, home domestic violence is increasing. So this is also a kind of urban issue that children are getting affected differently. They do not have the space to dissipate their energy. So they are also home quarantined. Most of the people are home quarantined, even if you don't say that we are home quarantined, but lockdown is a home quarantine. So kind of everybody is home quarantined. So how we look at this entire system. And last but not the least, that important point is the disposal of these masks, plastic things which are coming up again into the urban system, PPE. I saw many of the cities I just traveled, because I lost my own brother with COVID-19 10 days ago. And we saw in the city of Patna, we saw that everywhere there is a mask thrown out in the roads, PPE kits are thrown out. So where this urban disposal will go, when we are worried more about that to check floods, we need to have the drainage clear. So now it will have a cascading disasters. So that during disaster and how it will have the cascading disasters is a kind of a challenge for the urban planner as well. So I would stop here, but definitely the budget Government of India in the Act has a provision of Disaster Management Act, and that is being utilized. So urban, whether this is COVID-19 or other disasters which are going together, like Apan and others example I've said, and many more to come, like Bihar floods, 18 districts of Bihar is flooded, Assam is flooded. So in the COVID, many cities are into grappling with these challenges. So how that city can actually come out of these issues with the non-choking of the nalas and strengthening of the capacity of the municipal corporation, local governments. Thank you very much indeed. Thank you very much, Raina.
Thank you, Professor Santosh Kumar. And I think you have raised some very pertinent issues. How one, of course, the situation is uncertain, and we have to plan for that uncertainty when we are trying to address the pandemic and future proofing, plus also how it is affecting each and every community, each and every individual across the country, and which, of course, is going to have a lot of effect and impact on how our settlement patterns would evolve, how our economies would evolve. And also, you highlighted the need for capacities of, strengthening capacities of the cities and the urban local bodies. We are going to come back to some of these points later. But before that, may I request Dr. Panayotis Karamanos, who's leading the India program of the International Urban Cooperation. Panayotis has more than 20 years of experience in the environment, urban development and climate change sector. And he's been working in India for quite some time now, and he's also worked with a lot of EU cities. Panayotis, may I request you to, deliver your initial remarks, and perhaps as part of that also highlight some of the experiences that you have seen in your experience in India and in the European cities. Over to you.
Thank you very much, and also thank you to NIUA for this opportunity. I would appreciate if you can put up the relevant presentation. As indicated, I work for the International Urban Cooperation Project by the European Union, which brings together both the European Union cities and Indian cities on sustainable urbanization issues, but also on climate issues. And I think there is a close relevance also to the discussion today. If we look at the overall statistics across the globe with the relevant map, we'll see that India is, unfortunately, if we go to the next slide, please, thank you. That India is in the top 3 countries in terms of COVID-19 impact. Now, together with the United States and Brazil. However, I must say that this picture is a little bit misleading, given that it treats India as a full country, of course, but it does not look at the various states, which the situation can be quite different. But regardless of the actual impact, what is true across the world is that the cities are at the center of the response. So as we move on with this discussion, and we can go to the next slide, please, I think it's important to clarify 2 important qualifications. First of all, that the analysis that we're making today is retroactive for an unprecedented health, economic, and social challenge. And what I mean here is that we are discussing today in July about an issue that started a few months ago, and it was so unique in terms of its impact that nobody had ever developed a response plan. So now we know much more than we knew 4 months ago. So sometimes we may be a bit hard in a criticism, but we need to take that into consideration when we are doing our policy analysis and we're developing our future plans. The second point that I want to make is that, as I said, we work with a number of European and Indian cities. It's quite challenging to compare India and the European Union in many respects, but still, I think we can find some common ground and some important lessons learned. I come from the country of Greece, which is a very small country, around 10 million people. I have been in Greece now for the last 5 months because of these travel restrictions. And Greece, surprisingly, has done a lot of good work. And I'm saying surprisingly because Greece has faced a number of policy failures in the past regarding its economy and other issues. But how can we compare Greece with 10 million when this population is half the size of Mumbai? So although there might be some lessons to be learned, at the same time we need to be to understand what are the constraints in this comparison. If we go to the next slide, please, I think there are some important key variables to consider when we talk about the COVID crisis. And one of the most important ones is the coordination between the various stakeholders, whether this is the national government, the state government, or the cities themselves, the non-governmental organizations, the citizens, the media, and so many others. Of course, we have to look at the health infrastructure, which has been a very basic pillar in the response, the level of the city autonomy, which is very important, the size, as I mentioned before, and a number of other factors that might be relevant to the EU or specifically to India. So going to the next slide, I think there are some key lessons to be learned from this process. First of all, in terms of the governance structure, I think there are a number of lessons to be learned, but I think what is important is that city-to-city cooperation after the impact from COVID-19 is very, very important. Cities can learn from each other what has worked, what has not worked, what is the actual structure that helps them proceed with all the measures to address the challenge of COVID-19. Of course, this is an ongoing process, and it's, of course, very important to be flexible and to reassess the situation. If we look at the experience from Spain, where they have been very flexible in changing the rules for the municipal corporation, which is the equivalent of the cities in Europe, in order to be able to use the budgets more flexibly or even to have arrangements for virtual meetings. Early interventions were very important. For example, the lockdowns. The lockdowns were useful in order to buy some time in order to address the health challenges and build the necessary structures for responding to the COVID situation. Smart technology to provide updates to population. This has been used extensively in Europe, in the UK, or in Hungary, in order to update about what is the latest status or to increase awareness. And of course, innovation. You know, one typical example from India has to do with the trained hospitals, which of course it's very relevant to the Indian scenario. But in the workplace, what we're doing today is actually one of these relative innovations in the sense that now we realize that we can do from home what we thought could not be done in the past. So there are a number of lessons to be learned, and through our program we have worked with cities in Europe and India in order to exchange these best practices. I want to finish my opening remarks relating to or generalizing a little bit more and indicating that COVID-19 might be unique, but it has a lot of relevance to other challenges that are coming up. And if we go to my last slide, I think this is important to mention, and this was stated by Nicholas Stern, who is a well-known figure in the area of climate change, that the climate emergency, which is real and is happening, is in a very similar way to the COVID-19 crisis, but it's just in slow motion and much graver. So we need to take that in consideration when we plan for the future. Thank you very much.
Thank you, Dr. Panayotis. I think there are two key points which I am taking from your presentation. One is, as you said, of course, there are these common areas of intervention. So, for example, the governance structures, the technology or innovations that could help us in addressing such kinds of pandemics and risks in future. But each action plan for future will have to be specific to that region, taking into account the kind of capacities, the kind of resources, and the kind of strengths that city has and how do they leverage it going forward. And of course, city to city cooperation is something that can be a very, very critical, process in this regard, how cities from across the globe learn from each other. And at the same time, how do we also learn, apply these learnings to other risks, for instance, that of climate change and addressing other disasters. So with that, I would go to the next speaker for their initial remarks before I come back to you with a round of questions. Perhaps next on the panel with us is Mr. Mahesh Harare, who's the Chief Resilience Officer from Pune as part of the Global Resilient Cities Network. Mahesh has over 15 years of experience in urban planning, policy, governance and reforms, and climate resilience, municipal finance. He's basically done everything which any expert in the urban development field can do, and he has lots of experiences to share. More recently, of course, he has been working very closely in Pune during in terms of addressing, mobilizing resources and mobilizing efforts during the pandemic, and before that for other resilience initiatives. Plus, Mahesh, I would also request you to perhaps, during your initial set of remarks, perhaps touch upon the experiences from Pune and other cities from Maharashtra, because Maharashtra has actually been the worst affected state, so to say, till now in the country. And what are the experiences and learnings from there? Mahesh, over to you.
Yeah, thank you, Raina. I just share my screen. Can you see my screen?
On the screen share.
Yeah, maybe Raina, you can share the presentation from your end. I will start the discussion. Yeah, thank you, Raina, for the introduction. You all know that Pune is located in the western part of India, and it is one of the badly hit cities under this COVID situation, and it is not the metro city compared to Mumbai and other capital cities, but still it has been under the pressure because of the COVID situation. But still the city is trying to manage this situation, since it's very dynamic in nature and you need to have a dynamic strategy because it's changing over the period of time. Initially, the government was not aware about the overall the character of this kind of a pandemic, how it is expanding and all. So they tried different strategies, different actions. Can you go to next slide? And the first case was around the 10th of March, which was discovered in Pune. Then the certain areas started closing down. But what city tried to do over the period of time was prepare a focused strategy, basically on the contact tracing. And it was a multi-pronged strategy where city started looking at the direct contact, the first contact, we can say. Then city established the mobile ambulances also, so that they can reach out to more people over the period of time. Then the house surveys were also started, because the pandemic had both the symptomatic and asymptomatic cases. So to cover that, and also to cover the larger population, since Pune's population is around 55 lakh, that is 5.5 million. So to cover the population, it was required. And at the same time, flu clinics were opened so that people can access within their locality. They need not travel because there were travel restrictions as well. And this has worked very well. It had given a lot of input to the government, to the municipal corporation to plan it better. Then the city started basically looking at the data in a different way. The spatial mapping was done as shown in this slide, and then the ward-wise information was shared because the city administration felt that transparency and sharing information was critical. That way they can actually communicate it better to the citizens and also with the other decision makers and other agencies so that they can work hand in hand. There were a lot of challenges in the initial stages. The requirement of hospitals and beds, the healthcare facilities was critical, and the city started looking at that aspect as well, where the private sector was involved. The private hospitals were brought into the picture. Some of the college hostels were brought in the picture as a COVID care center, so that in a short period of time, the capacity can be ramped up over the period of time. At the same time, the city administration was looking at the lowering of the positivity ratio and also trying to reducing the death ratio, because there are some denser areas in the city, especially the core part, where there is a slum population, which was also badly affected because of the COVID pandemic, and the social distancing was a major challenge in those areas, unfortunately. So that's why those areas need to be tackled in a different way. The mapping helped the city in basically taking the decision, utilizing the resources optimally. Now the state government of Maharashtra has developed a separate dashboard where the hospital availability can be seen for each district, for each city, and for each hospital. All the hospitals are mapped and tracked by different agencies. So the lockdown period has given that much time to basically look at this kind of infrastructure, setting up this kind of infrastructure, use of a technology and IT to work faster, respond faster. So you can can you please go to next slide? So initially, the cases were not increasing at a rapid rate, but the month of April and May saw the rapid increase. But again, once the government, the city administration had control over it, then the recovery rate also increased, the number of healthcare facility also increased, but still there are challenges going forward because the positivity ratio is more than 20% currently. So the city is using now both the conventional testing and then the rapid testing as well, so that they can cover maximum people and address that. Fortunately, the fatality rate has reduced below 3%, but still it's around 2 to 2.4%, which need to be brought down. Extensive tracing has been done where a lot of almost all the households are covered within the city limits, and this is shared with the public, with the media, with the researchers on a daily basis. This kind of information is shared. Even the ward-wise information is shared because the people involvement is also very critical in this kind of a situation. And once you share the information, you are transparent in terms of showing which are badly affected areas. People also take responsibility in those areas and other areas to basically abide by the law and abide by the guidelines of government. Next slide, please. So this entire management, the challenges were not faced by the government alone. There were multiple departments of government were involved. There are twin cities, Pune and Pimpri-Chinchwad. Both administration were involved. Then there is a state government, central government. Along with that, the bus transport authority was involved to basically support the workers working in the emergency system. That was also critical. The district collectorate was involved, police were involved. The role of collectorate was also important because the city has very much developed urban agglomeration where people travel across the city limits. So that is also critical. A lot of housing is there in the outer area. That's why all these agencies had to work together to basically address that issue, giving a guideline to citizens. Private hospitals and medical colleges responded very well. They supported the city administration in handing over their premises and supporting in creating a facility for COVID care center, creating facilities, especially for the ventilators and ICU beds. At the same time, the industry association also created some platform where they were voluntarily supporting for the healthcare equipment, PPE kits and masks. A lot of NGOs and traders were involved, citizen groups and the industries through CSRs supported the food supply, health equipment supply during the lockdown period, which was also critical because during the month of April and May, it started hitting the slum areas and densely populated areas where the vulnerable population reside, and they were affected economically also. So during that time, this help was very critical and very important to have the lockdown properly done. A lot of NGOs were also involved, citizen groups were also involved in supporting that. I think this was a collective effort, still it is a collective effort. Now city is trying to basically contain that in certain areas. Certain areas are contained very effectively through this exercise use of technology. And going forward, we see that with the increased effort, the curve will flatten out hopefully. And then we can see how the recovery can be done post that. Thank you, Raina. Over to you.
Mahesh, thank you for sharing this, experience from Pune. I think it's quite a learning in terms of how, as you have shown, different stakeholders have come together for collective efforts in terms of addressing the pandemic. You have, put across one point which is of quite interest, and I'll take that ahead as a question to you once we come to the question answer session. But before that, perhaps we can just quickly reflect on the polls. If you see in the tab on the right, you would be able to see how the different participants have responded to the poll. So our question was, in your opinion, which of the following has been most critical in your city for responding to and managing the impact of the pandemic? And the largest share of votes has gone to proactive local government authority, providing regular information and response and relief measures. This is followed by three other criteria. One is well-informed general public taking necessary precautions, proactive communities, and finally adequate health infrastructure and efficient public health measures. So I think I would say to some extent this is reflecting on the points which most of our panelists have made. But with that, I would want to put across, I'm looking at the time, so maybe we can take up one question for each of the panelists. And Mahesh, I would like to start from you because, you mentioned about, in the last comments, you mentioned about how different communities have come together to respond, how different stakeholders have come together to respond. However, there is a lot of what we have seen that there is a lot of challenge when it comes to slums and when it comes to more densely populated areas. This is something which we have seen quite a lot when, the Dharavi case was being discussed. This is something you have experienced in Pune and many other cities across the country. So from an urban planning perspective, as an urban planner, as an urban planning practitioner and as a resilience practitioner, how do you see, what specific measures that can be taken up, keeping this in mind that while we are trying to address these risks, we are also, planning in a way that we are taking the density arrangements or planning tools into account, and especially for, slums and most vulnerable populations where there are, probably lakhs of people residing in a few square kilometers of area. So how do you address that situation when it comes to design, when it comes to planning, when it comes to addressing densities and perhaps sanitation and infrastructure?
Yeah, I think it's a long pending question over the period of time we have seen. This is a major challenge for the urban planning. But it's not question of only providing housing for the slum. So straight away, some might say that slum rehabilitation can be a solution. That may not be, because source of livelihood is a major reason. That's why people are there. And also unavailability of affordable housing and plus the mobility. So these three are important factors, I think, which are actually related to that. A lot of people settle in a close proximity to their livelihood to basically reduce the travel cost. Their economy is also very low. So I think this is a very complex situation in which we are saying, at one side we are saying densification is required from a mobility point of view, where we want a larger population to basically have a sustainable cities. And now with the COVID situation, we are doing exactly opposite. I think it's not only question of the slums or the denser areas. I think one need to look at the decentralization of all the facilities. It can be vegetable market also. So in each of the city in India, we have APMC kind of a market, agriculture produce market. So those are located especially in the central part of the city, and if it is a containment zone, it's closed. So you can imagine what kind of a situation will be there. So right from the food supplies and then to the infrastructure facilities, housing, lot of decentralization need to be looked at. A lot of neighborhood level development need to be looked at. It's not only about slums, it's about overall development as well. I think that is critical going forward.
Thank you, Mahesh. Notice I would want to, pose the next question to you. So, you mentioned about how some of these learnings that we are, getting from this experience are also relevant to addressing other risks and also relevant to addressing other disasters. You are, of course, working in the climate change sector, and you are supporting a number of cities in India and in the European Union on preparing their climate action plans. So in your opinion, how do you see these learnings getting integrated into that process of climate action planning? And how do you see, maybe one or two key points which you feel can be directly, probably adopted or adapted to that process? Panayotis?
Yes, thank you very much for the question. I think that what is required, first of all, what I have experienced in India is that a tremendous amount of knowledge and motivation on issues of climate or issues on health, specifically about COVID and other topics, of course. So I think what is necessary to ensure that the structures are there, the internal structures, especially at the city level, to ensure that the city can respond to any type of emergency. Because all these types of emergencies, this time it's COVID-19, next time it's going to be climate, there may be many others which are more immediate or least extreme. But what is required is this kind of structure which will allow a flexible response and an effective response. What is required at the city level, and I think this is a time for India to look into its internal system of governance, is the municipal corporation in its current form in India able to respond to these challenges, and if not, what kind of changes, and take up this opportunity and do these changes in a more practical manner. But three things I think are very important that will come back to us over and over again. One is the need for bold decisions. Putting a lockdown is not an easy decision for any kind of country, and especially for a country like India, where people enjoy their freedom and democracy is at the heart of the country. So that's a very difficult decision to be made, but in this case, it was necessary. The second point is effective communication. You need to communicate to the population about the need for these types of restrictions or any kind of measures. And the third one, which we may consider as given, but we have seen that in many other countries it's not, it's very important to follow the scientific advice, and their development, because science is very, very important, but it also develops and it's a continuous learning, and relate that to the policy process. You cannot have just scientific advice because that may not be very easy to communicate to the people. So you need a combination of the both. So I think that kind of provides an overview of or response to your question.
Thank you, Panayotis. I think you have really summed it well. Bold decisions, communicating, and providing scientific evidence to the actions that we have taken. On that note, I would now want to come on the governance aspect of it. And there are, Professor Santosh Kumar, there are a couple of questions that we have received from our participants on that front. You talked about how there are, these different structures, there are these different departments who are coming together and trying to coordinate in terms of responding to the pandemic. But do you think that has been adequate, or do you feel in certain instances there have been, as one participant has put it, some kind of knee-jerk reactions too early which were taken? And if that is so, how do you foresee, multiple agency coordination happening towards responding to risks at the city level?
I would not say that is a knee-jerk kind of reaction. because every countries of the world, they were taking such kind of a decisions where they are playing with the uncertainty. They did not know about the character of this kind of a pandemic. So somebody, even if you see that how UK has behaved and how New York has behaved, and the local governance where the mayor was coming television and time and again and talking to the people. That was where the decisions were taken in terms of that whether we should be going for the close down or a lockdown or not, or kind of a. So what which I'm trying to say that this was a kind of a new phenomena in itself for all the countries of the world, including India. India, when it came to India, then the governance got together and Government of India created 11 empowered group, which had this different kind of a ministries parting together at the national level. So all the ministries got together and they were giving their kind of a services, coordinated effort, which was coordinated by the crisis management group. So crisis management group was all the secretaries of different departments were represented there. So this structure were working in the time of kind of a cooperative federalism, where the ministers of the state and the chief ministers, honorable prime minister, was taking feedback again and again from the states, and whatever the requirement of the states, they were supported by the national government. So they also allowed the national government also allowed to take decision in view of their local conditions. So and the Government of India was supporting that initiative. So the point is emerging in terms of that in this kind of a bigger scale disaster, where we do not know when it will end and how it will start and how it will behave during the disaster also. So this kind of approach was taken and everybody was consulted. And so that was initially when Prime Minister said, "Jaan hai to jahan hai," means complete lockdown, and probably said that it would go. Then later, when economic was dooming and everybody was criticizing that economy is not working well, and we have to have. Initially, we had a lower percentage of growth, and then we said that now it will go further down and it will go with a negative growth rate. So that urban cities, which we say that they are the engine of growth, and that has to be opened up. So he came with this kind of a Jaan hai or Jahan bhi hai. So Jahan hai Jahan was kind of a little liberal approach in terms of unlocking essential services. So the governance was also learning that how to actually go ahead in meeting these challenges. So that economy has to be restored, and side by side government was also facing the problem of the laborers from movement from one district to another district and to states to other states. So that was also a challenge. I would also highlight in terms of like say a special case of Delhi, which has 3 state boundaries. So what the decision taken by the Haryana government is affecting Delhi, and what Delhi is taking decision is also affected by UP, and UP is taking decision is affected by the state. So how these 3 kind of a coordination between the states also emerged as a kind of a major challenge, and that later part, initially it was a kind of a little confusion, but later part it was resolved. So what I'm saying is that it's not a knee-jerk approach, which we're saying, when we did not anticipate, and it's not only true for India, but for all across the globe, we're saying, although many few smaller countries were very organized, and they, like Vietnam, Korea, and others, they performed very well. But when it comes to India, it's 1.30 billion people. So how to have a kind of the system and different states and different governance, and accordingly the different political parties. That is the reality. So how to have this kind of a control together, this kind of a mechanism, and all the state governments, irrespective on the party political line, they cooperated with the national government, and every time the decisions were taken. So the structure was what formed. The National Disaster Management Act was followed by all the states, and the national government also actually executed, and that was the first time in India which was the National Disaster Management Act was put into place for actual governing this disaster. I can't hear you.
Rana, you're on mute.
Sorry, thank you for pointing that out. I was saying thank you, Professor Kumar, and to all the speakers in this panel for sharing your insights and experiences. Clearly, there has been a lot of learning. The challenge for us now is how do we incorporate it going forward? And on that note, I think it is time for the next panel, and our next set of speakers would be providing their insights on the same. Over to you, Vaishnavi. Thank you.
Thank you, Rana, and all our panel speakers for that interesting session highlighting the on-ground systems, capacities, and resources in addressing challenges to such risks. Before we proceed with the second panel, I would like to mention details of the second poll. Our second poll is to capture your opinion on the important measure governments should take to future-proof cities from such risks. This poll will be active through the second panel, and please choose among the 4 options that's available. Moving on to our second panel on leveraging multi-level governance for strengthening urban resilience. I would like to invite my colleague and moderator for this panel, Dr. Uma Maheshwaran Rajashekar, who currently holds the position of Chair, Urban Resilience and Team Lead for the Climate Center for Cities at NIUA. He's an urban resilience professional with over 17 years of experience in urban projects in Asia, Europe, and US, developing country strategies, policies, climate change analysis, hazard modeling, institutional analysis, adaptation and mitigation plans for the governments and the multilateral agencies. Over to you, Mahesh.
Thank you, Vaishnavi, and good evening, everyone. And so we have with us a very interesting group of panelists to discuss on multi-level governance for strengthening urban resilience. So before we enter into the panel, I just wanted to, there are multiple definitions for governance, but one of the definitions which we would like to stick for this particular discussion is the rules of institutional system to solve conflicts between various actors to adopt decision making or adopt a decision. And always we all know that good governance is at heart of any successful development, either it is at a city level or at a state level or at a national level. And it is also essential for an organization to achieve its objective and drive improvement. So with that in mind, and also our constitution acknowledges that our government is of the people, for the people, and by the people. So without further ado, I would like our panelists to reflect on these points. Our first panelist is Mr. O.P. Agarwal, who is the CEO of World Resource Institute. And at World Resource Institute, Mr. Agarwal is leading the institute's work around cities, energy, climate, landscape restoration, water, government and business engagement. He has previously served as the executive director at the Indian School of Business and also chaired the US Transport Research Board Committee on Transportation in Developing Countries. He has also served as a member of the Indian Administrative Service and has held several positions from 1979 to 2007. During this tenure, as a head of the Urban Transportation Division of the Government of India, he has authored India's National Urban Transport Policy. He is a respected thinker and a practitioner with a wealth of experience, and we are hoping to hear from you, sir. The first question for Mr. O.P. Agarwal, government of the people. And the pandemic has reiterated the importance of effective national, state level, and also city level government structures. And in some cases, it has also identified the loopholes and the emergency response mechanisms. Going forward, how can government institutions be further strengthened? Or do we need a restructuring, at least at a departmental level, to manage such further risk? This is the first question. And the second question is, in what ways can other organizations contribute to the process of building such institutions, either in collaboration with city government or with state government or with national government? So over to you.
Okay. Sorry about that. Thanks for pointing it out. Good evening to everyone, and thanks for the introduction, Mahesh. Thanks to NIUA for inviting me to join this panel and the fascinating discussions I just heard on the coronavirus pandemic itself. It was really fascinating to me, and as I kept hearing that, the few things that kept coming to me, I've always admired the kind of response that we saw from the cities in dealing with this pandemic. There were many criticisms of various actions taken, but I have always felt that these criticisms come from people who've never had the benefit of how do you take a decision without, without the benefit of hindsight, let's say. When you have the benefit of hindsight, it's always good to it's possible to get wiser. But when you don't have that and you have to take a decision which is only forward looking, you don't know which way is the right way. You take a risk and you take a decision. Some of them will be right, some of them may not be right. But at that point of time, you've taken a certain decision. And I think in this particular case, our cities and our frontline people who were at this have done a phenomenal job, absolutely phenomenal job. In fact, we have documented a whole lot of initiatives that were taken in the different cities and come up with a little publication, which I think should be out fairly soon. But this really, is coming out of my respect for the kind of work that was done in the cities. But that was as far as the pandemic is concerned. What I would like to do is go a little beyond the pandemic, go a little beyond and look at how do you deal with such situations in a wider framework. And my own experience, let me draw from that a little bit, was a lot about dealing with riots, law and order situations, and floods in Assam when I was posted as a district collector. This was way back in the early 1980s, but that is something to draw on. And one of the things I noticed there was the immediate first reaction has to be from the local administration. Whether it's the city administration or the district administration, the first reaction has to be from there. But at that level, you are not adequately resourced to be able to take it beyond the first few days. In fact, you neither have the money, nor the technical resources, nor the capacity to go beyond the very first reaction that you can possibly. But that first reaction is very important, and timely first reaction can really save a lot of lives. After that, it is the state government that really have to come in. And when things become very big, like it happened in the case of the pandemic, obviously the national governments have to come in and international bodies have to come in. The pandemic was unique in the sense it was a disaster that nobody knew about. Nobody knew how to deal about it. Nobody knew what it is. Nobody knew. Floods by now have become fairly well organized. You have manuals on how to deal with floods. So what happens in a flood is fairly well known. The geographies may differ, exact locations may differ, but by and large, a rescue rehabilitation plan for something like a flood or an earthquake by now is fairly well known. On the pandemic of this nature, nothing was known. That was unique, and that's why I really say it's a phenomenal job that has happened. I think what needs to happen is, if you have to build up institutional capacity for this, dealing with disasters like this or building resilience, I think a very important fact is building capacity. It's not just institutional capacity, but also human capacity in terms of the people who are on the job, who are responsible for this. I would even say building capacity amongst the citizens at large on how to deal with a situation like this. It can't be governments alone. Governments have to be supported by the people who live there. And building capacity is something which has economies of scale. You don't build capacity at a city level. You don't build capacity at a village level. Capacity building has economies of scale. I think, when multiple cities come together, when multiple states come together, that is where capacity building happens at optimal costs and optimal quality. So that is one thing where multi-level governance really needs to be leveraged. The second thing is really learning from each other. What are the mistakes that we made which the other one probably was correct about? How can we learn from each other? I think that peer learning, and that has to be facilitated. One city is very difficult for one city to really reach out to another city and do it on a bilateral basis. This is where higher levels of government have to really come in and facilitate this peer-to-peer learning, not just across cities within a state, but also across cities over the country. That is the second. In the Indian context, our constitution, for historical reasons, our constitution has put in a federal structure where the center is more powerful, let's say. And when you say powerful in terms of the financial resources, It's really the center that has more money than the states or the cities. And there are historical reasons for why this has happened. But given this situation, I think financial resources are a very important component of dealing with resilience. And that's the reason why the government of India has come up with programs like the JNNURM, the Smart Cities Mission, and all of that. The reason they have done it is, despite urban development being a state subject, why has the government of India got into it? It was primarily because the chunk of the resources is with the central government. That kind of resource authority or resource power is not there at the state level or the city level. That's why the government of India has come into it. The one beauty that we see with the multi-level governance system in India, compared to many other countries where you have a federal structure, is that in India you have a civil service. Even though, multiple states may have different political parties in power, cities may have different political governments in power, yet you have an administrative structure which is uniform. And this administrative structure is trained in a certain manner, they interact in a certain manner, they sort of shift between the central government and the state government. And I think this is the one unique thing in India by which, despite differences in political governments, you still see a fairly uniform administrative arrangement across the country. And I think this is what we should leverage to make sure that just because my state has a certain government, a certain political government, the central government may have another political government, yet within the administrative machinery, they're able to get the benefits that other states also get. Certain amount of uniformity. So I think the multi-level governance, the best way to leverage this is to take advantage of the scale economies that you get, take advantage of the higher resources that the national government has, and take advantage of the uniformity that has been put in place in dealing with pandemics or disasters of this nature. Let me leave it with this for now, Mahesh, and I'll come back if there are any further questions.
Thank you, sir. I think that's quite interesting to look at the three aspects, the financial, the scale of economy, and also the uniformity. With that, let me move on to our next speaker, Mr. Amit Proti, who is the Managing Director for APAC Region, Global Resilient Cities Network. Mr. Amit Proti is an urban planning and green infrastructure development expert with almost 2 decades of experience. And he has worked on implementing key urban development and resilience programs in India, Southeast and East Asia as a part of 100 Resilient City program funded by the Rockefeller Foundation. As a part of the Head of India strategy for 100 Resilient Cities Network, he was also instrumental in setting up the Urban Resilience Unit at National Institute of Urban Affairs. Amit, welcome. And the question to you is, institutional governance. Moving from political governance to institutional governance, which are for the people. I know Rockefeller Foundation and GRC and other developmental agencies are working towards contributing to the development activities which are centered for the people. And cities across globe, that said, the cities across globe are facing various issues apart from pandemic. Like our previous speaker rightly mentioned, there are cyclones, floods, heat waves, and other disasters which stretch the resources thin. In this current scenario, how can multi-agencies, either within the cities or across the globe, organize and coordinate amongst themselves to better contribute to managing disaster scenarios such as the current one? Amit, over to you.
Thank you, Mahesh. Thank you, NIUA, for having me, and thank you for all the other participants. I think it's really been an interesting hour already, hour and 10 minutes, just listening to the different perspectives. Mahesh, if you don't mind, I had a presentation, if that can be put up, because I'll walk through some of these thoughts and hopefully be able to answer your question. That's the last slide, so maybe the first one is. So Mahesh, that's the last slide. Yeah, you go all the way up. Next slide. Okay, I'll get started and then, just move it to the next slide. I think it's clear that the impact of COVID-19 has been uneven within countries. I think we've all several people have said that. We've also understood that cities have faced the brunt of the pandemic, with poorer high density neighborhoods experiencing a greater share of cases. We just saw the example 2 days ago where Mumbai did testing and found out that slum population had already had 50% of the slum population had already had COVID cases, and it was only 16% in the community. So clearly COVID is very heterogeneous in the way it's been seen across our geography. Some cities and regions have suffered more than others, particularly those that are highly dependent on tourism or linked to global supply chains. So again, I think when we look at countries, it's actually the impact is not at the same level. It's very different across cities within cities. Governments right now are clearly focused on crisis management. I think the previous talk was predominantly about how are we responding to the crises. But there's also now across the globe, and I represent a network that has around 100 global cities that are starting to think about, what are the long-term implications? How do we start to think about how do we deal with not only COVID, but prepare for the future? And then we have experiences that show that cities and countries that had actually experienced pandemics, and you look at South Korea and Singapore as two examples, they actually had some systems in place already to be able to be a little bit better prepared to deal with COVID. Singapore had a readiness and response plan for acute pandemic situations. So what we are learning is that cities are learning, and cities are learning not only by experience, but also from each other. If you go to the next slide, I think one has to recognize that when you're talking about resilience, you're talking about the ability to build systems that can withstand any stress and any shock. Because we don't have the ability to actually plan for every stress in the system and every shock. And we see already from our global city experience that cities that had already understood the resilience challenges or were looking at urban resilience closely and had identified some key stresses and were working to address those key stresses actually had some systems that fared better during the pandemic. And I'll give you a couple of examples. Quito, Ecuador, for example, had identified, so they had worked on a resilience strategy over a couple of years. In 2018 or 17, they had identified that food security was a challenge in the city for a variety of reasons. And they had taken it amongst themselves to actually address food security. When COVID hit, they suddenly had the ability to mobilize not only food banks that they had already been thinking about and urban farms, and were able to feed 100,000 vulnerable people in the city. Now, they were not thinking about COVID when they were thinking about food security. They were thinking about food security as a stress in the system, and they were planning for that stress. And when COVID happened, they were able to mobilize that resource. Buenos Aires in Argentina had taken an approach that they wanted to push digital technology, strengthening digital systems in their city before the pandemic. This was, last couple of years, they've been planning it. They've been training teachers to understand digital technologies. They've been getting students to be better equipped with digital technology and systems and devices. And again, when the pandemic hit, they were sort of ready when students had to go towards online learning. And the same thing with Seoul. Seoul has been working on community centers for a long time. And they had essentially been working on community centers as a way of strengthening social systems in the city. And again, when the pandemic hit, those volunteer systems, those community centers functioned extremely well at the local level to provide support. The reason I'm giving these examples is essentially to say that, when we are thinking long term, when we're thinking beyond COVID, when we're thinking what is the new normal, when we're thinking how do we move out of this, we need to start thinking of solutions that are going to be able to address multiple disasters, multiple stresses, because we cannot just plan for every disaster at one at a time. Yeah, and these are examples that are already showing that investing in resilience upfront actually pays in the long. Next slide, please. So what have we been doing? I think as Global Resilient Cities Network, we do focus a lot on peer learning, and I think Mr. Agarwal also mentioned, the value of peer learning. It's incredibly important. And for us, as a network of 100 cities in all different contexts, in India, in Australia, in the US, we've got cities all over the world. We have spent the last 6 years essentially coming up with systems that have helped not only cities to learn from each other, but within cities to have variety of stakeholder engagement processes that can break apart the complexity of a problem and then start to say where are the gaps and who has to make certain decisions to address that problem. Yeah, so we've been able to build tools of stakeholder engagement. These are some examples on the right, and one of them is actually with the IUC, where we built a partnership between Surat and Rotterdam around water management, because again, that's clearly peer learning that we felt there was value in building that peer learning relationship. And the one on top is actually a collab, again, a stakeholder engagement methodology in Cape Town. When last year Cape Town was dealing with day zero, we were able to work with a variety of national and city government officials to understand what were the decisions that need to be made and then articulate those into a certain methodology. So next, and that's the last, I think, one more slide. So as a network, and this goes back to your question about, how are we building institutions? I think what we've been trying to do is provide examples. So, we've now set up a platform that is focusing predominantly on resilient recovery. And through that platform, we are sharing examples from cities. We are providing tools of engagement. And these tools of engagement are important because they're framed in built on this last 6 years of experience. They're providing opportunities for cities and stakeholders to say, okay, we have certain decisions, and if we have a certain decision to make, here are some tools that can help make those decisions. So this is just, again, an example. Greater Manchester is looking already at a 1-year living with COVID resilience plan. So they recognize that they have to live with resilience. How do they make decisions around that? They're using some of our tools to make that. So peer learning tools, methodologies to break apart the complexity and help better decisions. That's how we are trying to bring the complexity down within the network. I'll stop there, and then I'm sure there'll be questions I can answer. Thanks, Mahesh.
Thank you, Amit, for the wonderful insight and how GRCN is looking forward to achieve more of institutional collaboration and coordination. That I'll move on to our next speaker, and our next speaker is Ms. Charu Chadda, who is the Policy Programs Manager for India and South Asia, Facebook. Trained as an architect, Charu has completed her MBA from University of Oxford with over a decade of experience across non-profits, private sector, and academic institutions. She has been exploring innovative approaches to public policy design, and in the last few years, she has been focused on designing of policy for emerging technologies. And I'm sure no further introduction is needed for Facebook, but it's also important to address the fact of governance by the people, Charu, based on your experience of Facebook's Data for Good program, what has been the role of data and social media platforms contributing to community-level coordinated actions on the ground? Can you highlight some of the experience and also some examples using Facebook Data for Good? Charu, over to you.
Thanks, Mahesh, and thank you so much for the opportunity to share our experience with this amazing panel and group today. So I think maybe two bits to start with. I think, like you said, what is the role that a social media platform has in a place like this? And I think more than anything else, we've seen social media platforms being used for civic action. Right, so all the way from people coming together as communities, as hyper-local communities, but also large, groups coming together to figure out. So caremongers, for example, was a community that came out just to figure out how do you care for your community if you're no longer there. We had other, for example, initiatives that were led by the company itself. So PIN code, for example, was an initiative where the idea was how do you form, now that I cannot physically reach out to my neighbor, what is the best way for us to communicate? How is information getting connected? And I think, it's not just as much as it was for civic action. I think what was really interesting that we saw during COVID was the governments were actually very proactive. So a number of state governments, for example, came up with their own chatbots, their own messenger systems. So it was, adopting technology in a way to connect with their own citizens in a fairly proactive manner, right? So I think even before the World Health Organization chat kind of became live, a lot of the state governments were live in India. So I think for us, that has been a really interesting experience in seeing just how both citizens and governments have embraced communication technology as a way of coordination and for enabling civic action. I think this kind of also, had like second level effects. For example, we had specific products, like blood donation, which were really looking at, okay, now that we're coming together, what are the use cases that we're trying to solve for? What are the things that we need? So I think that, most definitely has been one of the strongest use cases that we've seen of the platform, and just in terms of how people have come together. I think what has been also interesting in, just specifically talking about the Data for Good program, has actually been this, and it kind of got spoken about a couple of times, like when you face something like COVID-19 as, governments and citizens, everybody wants to approach it, how can I contribute to the situation? And we, for example, for the last 2 years had been working on a program which was predominantly looking at disaster response. And looking at how we could analyze data sets that we had and share it with disaster response agencies. So what the program essentially looks to do is analyze location data and try and create maps that can help people understand how movement has been impacted by a disaster. But COVID was obviously a different kind of disaster and kind of required us to do different kind of, statistical modeling around it. But I think not to kind of go into the technical layers of statistical modeling, but I think what was an interesting learning for us during COVID was actually that, for the last 2.5 years, we've been trying to figure out which is the right governance level at which, we should plug in this program. Actually, the same civic action bit kind of came in very handy when we were looking at COVID. So two things that I wanted to highlight. We actually helped form an international network called the COVID Mobility Network, which was, it kind of started with Harvard, but it was a global network of academics, both who were looking at, statisticians, infectious disease experts. And this kind of really speaks to the point of peer learning, right? So to get the work started in India, we actually had, statisticians sitting out of Harvard kind of telling some of the early institutions like IT Madras or IT Tirupati in just what they had done. This worked for us, this did not work for us, this is the kind of analysis that was actually helpful to state governments. So we actually, as a first step, we actually worked with academics to try and understand what kind of an analysis is even useful to a policymaker. Because a lot of people before me spoke that when a calamity like this happens, the policymaker actually has too many things to worry about. And they're looking for very targeted, useful advice or insights. And they're not really in a position to kind of brainstorm about how we could use. And I think having that layer of experts in the middle, which were really Indian academics and research think tanks, actually helped us kind of bridge, what was the policymaker looking for and what was the right insight. So we had a bunch of, amazing educational institutions kind of coming together voluntarily, doing these research reports, setting these dashboards up. And a big reason of why we could do it fairly quickly in India was actually because we had that peer learning system set up through the COVID Mobility Network, right? Where you were in the same group as academics from Italy, from US, and there was this daily almost sharing of models, right? Like I tried this is not working. Are you trying this? This has been a difference in our, so I think that just kind of having been able to set something like that up was instrumental in having to take off. It's actually been a learning for us in the bigger program around disaster response that we've actually never earlier established any kind of a peer learning network. And maybe that was one of the reasons we could never really take it off. But I think that's, to really speak about it from a perspective of what the Data for Good program did. I think the other, important bit to kind of highlight over here is this idea of looking at who all are the different actors. And again, I think a lot of people spoke about it. But I think for us, it was kind of important to understand what we knew as an organization and how we could leverage it, and who are the other partners that we should identify, right? And that you were kind of making sure that people who knew the best way to use this information, right, finding the right person in the government. I think that process was a very important learning for us. And I think a lot of times when you're in a rush to do good, you're less concerned about the process and more about how do I reach the end. I think what we've learned from from this pandemic is really that value of that process, and how existing stakeholders are actually, if you leverage them the right way, that's really how you create sustainable impact. Other than that, I think it's a bunch of stuff about the Data for Good program itself if everybody wants to look at it. So a number of data sets, etc. Happy to take any questions on that.
Thank you, Ms. Charu. And I'm very conscious of the time, and just before we conclude, let's have a couple of questions for our panelists. Mr. O.P. Agarwalji, you're in the call, I guess. And one quick reflection is on our poll. You had indicated that adequate financing and also use of data-driven solutions are quite important for government actions. But the poll indicates that a lot of people don't see that as one of the critical factor. Is it because there are very less government employees who are in this call, or it can be that probably it doesn't affect the common man that much? Your thoughts on that, please?
Yeah, I think what happens is people who are not within the government system, often citizens, don't see the financial side of things. But the person who's actually doing it, who's actually implementing it, he can't do it without the money. And he knows that he doesn't have the money. The money has to come from the higher levels of government. That's why I think citizens don't see that. But to be able to actually do some stuff, the financial resources become very important. But here, there are very innovative initiatives that were taken, which tend to bring in the community. And quite often for an immediate response and to be able to get the funds that you need or the strength that you need at short notice, innovative local officials have been able to mobilize the community. And in such occasions, you find that the community comes in very enthusiastically. Quite often that is more powerful than using the regular government system. But I think the main reason why this is not showing up is because of the profile of the people listening here. But internally, you know that the funds are very important.
Thank you, sir. I think the point is well noted. Going on, I think the second point which has come out is the proactive communities. And Amit, given your experience within GRCN, can you reflect on what are the key things which are needed for multi-institutional governance? I know within GRCN there are more than 100 partners who have come together. What is the critical factor for these multiple institutions, and how do you create governance mechanism to fight a common cause or to work towards a common cause?
Yeah, I think it's not an easy answer by any means. And you started off with the common cause. I think having a common cause and having some understanding of what you're trying to work together is incredibly important. And often we have found that that is not where you start from. When you put a bunch of different cities and people in the room, they come from an incredibly different perspective. And it takes a while for people to start to understand that when I'm talking about nature-based solutions and you're talking about water quality improvement and you're talking about something else, to find that middle ground takes time, which means you need to invest in that time and the people who can facilitate the discussion, who understand the different perspective. Yeah. Without that, it breaks apart. So having a common cause, giving time for conversations to happen so that people actually arrive at some common understanding, and then giving them the freedom to actually innovate. I think, Mr. O.P. Agarwal, you mentioned funding, but I think the other problem also I see often is lack of the ability to take risks. often the local government officials aren't able to take risks because it's not in their mandate. They aren't actually acknowledged and appreciated for taking risks because, if that delays the project, it's on their head. So, that becomes a factor as well. So giving people time, giving people the space to make good decisions and have communication, and giving some flexibility that you can innovate, I think that helps. And we try to do a lot of that through these tools and methods that people.
If I can butt in, I think that's absolutely right. The ability to take risks is virtually zero. It's really the system. It's not the person. It's really the system that doesn't allow that space.
And that's not just in India. You see that in a lot of other places as well.
That can go as one of the recommendations. Given certain emergencies, the operational powers of certain individuals who are willing to take risks, or the safe fail mechanism, or the cushion to take risk but to fail, becomes very critical. Thank you very much, Amit. And Charu, I know that you must be looking at the poll, and the setting up information systems have come up to be one of the most sought after by people. But even during the COVID, we have seen a lot of false information reaching out to people, and in some cases, it has also enabled a lot of people to come together. Good information to come together and do work for a social cause. Your reflections on it, and how do you think that governments can work more with Facebook and data for good, use that information for a better decision-making process?
Yeah, so I think I was looking at it and saying, yeah, this is exactly what we are hoping to see. But I think a very valid point that, and I think the COVID has been actually one of those examples where partnering with the government has been one of those ways to make sure that the right information was coming out. So, for example, one of the things that Facebook launched was Information Hub, right? It's the first thing that shows up when you enter Facebook as a source of all COVID information. But to set something like this up, you actually need to have partnerships. You need to have a government stakeholder from where you can source the right kind of information. So I think that actually pinpoints to what a lot of people have said, right? How do you foster some of these partnerships? And in case of India, I think existence of a Digital India mission, entities that were kind of consciously looking to create digital partnerships was very enabling in trying to find out who that person is. And I think at a company's level, I think it can be quite interesting to realize that even though a lot of information sits on your platform, maybe not everybody actually knows how to use it, which might sometimes be true of government partners. And to kind of really walk that way and saying, this is how the platform works. So kind of finding that way of how that partnership works. But I think it was definitely, in India's case, the fact that there was already a push towards digital and digital communication. We've actually saw the adoption to be fairly high, whether it was in terms of setting up information hubs, in trying to set up chatbots, in making those introductions, or even, in ministers or government using their pages in the right manner. So I think it kind of comes back to what is the nature of partnership and how both the entities need to move a little beyond what they usually do. But there's definitely a lot of value in it.
Thank you very much, Charu. With that, I would like to thank all the panelists for their wonderful inputs and feedback to this session, and the amazing participants who have been asking questions, taking the poll, and also staying with us even though we are 5 minutes delayed. Thank you very much. Vaishnavi, over to you.
Thank you, Mahesh. So yeah, this has been quite an engaging evening, starting from capturing the on-ground experiences in our cities to understanding the way forward with respect to strengthening our governance, addressing multiple risks, and of course the role of social media and data, to mention a few. I would take a quick moment to thank all our partners in making the COVID-19 Urban Thinkers Campus Series a success. And special thanks to our distinguished panel speakers for taking the time out this evening and sharing their valuable thoughts and experience. And also a big thank you to all the participants who've joined us today. You can follow us on our Twitter handle for updates and future events. Thank you all once again, and have a good evening.